What's up, everybody? I'm Steph George. I'm a licensed massage therapist and I work in Portland, Oregon. This is going to be the start of my second video series for self-care. And I want to start this one off talking about general information and tips. I don't want to be too overwhelming and give you too much information, but this series is going to be all about lower back pain. A lot of people will come into my office and they have discomfort either in this part, which is the SI joint or the sacroiliac joint, or they have pain in their lumbar area, the lower part of their spine. And a lot of this can actually go back to the psoas and the hip flexor muscles, which are deep in here, the muscles that flex the hip. Actually, if you refer back to my first video series, this kind of goes right along with muscles on the front of your body being tight and contracted, and then that pain or discomfort manifesting on the other side of the body. So when we have discomfort or pain in the low back in either of these areas, more often than not, it could be coming from here. Of course, there are several other reasons, but this is one of the main causes I see in my practice is from contracted and overused hip flexors. I want to tell you about the physiology of how this happens. With the hip flexors spending a lot of time in chronic contraction, which is the sitting and any time where your knees are up, or if you're working those really hard as a runner or in some type of sport where you're really engaging those all the time. What will happen over time is that because these are pulling your pelvis down, so this is neutral pelvic positioning. With those getting really tight, it literally pulls your pelvis into what's called an anterior pelvic tilt. You might have heard that expression before. So this is neutral, and then this would be an anterior pelvic tilt. So your butt really pops out, and then you can feel this space get really scrunched. And then that is why you end up feeling it back here, because this space gets so small and the pelvis really tilting far forward like that puts a lot of pressure on those SI joints. If you have pain in either of those areas, it is quite possible that it's coming from the hip flexors being so tight and contracted. The muscle starts pretty high up actually and attaches to the front of all your lumbar vertebrae, and then joins up with, so that's the psoas, and then joins up with the iliacus muscle, which is kind of like in this scoop of the ilium bone. It's all in there. They join together and then they dip down and attach to your inner femur, which is the long thigh bone. So if you think about that anatomy, think about when you're sitting. You can see how that muscle, those two attachment points come closer together. So when you're sitting, you are putting this muscle in contraction. If you sit all day at work, if you side sleep, say for example, in a fetal position, and you probably look like this with your knees way up. So if you have a desk job and you're a side sleeper with your knees up, you're pretty much just sitting a lot of your life, which is not great at all. And then any number of hobbies. If a lot of people who are runners or cyclists, they might really overengage their hip flexors. So just a few suggestions to get you going would be, if you do have a desk job, that if there's any possible way that you can get a standing desk and spend some time standing. Don't stand all day because that's going to be too much, especially at first. You probably want to see what works best for you with trial and error. I think a lot of people will end up maybe spending half a day standing and half a day sitting. Set a reminder on your phone to take breaks. And then if you are that side sleeper with their knees way up, if you are really committed to side sleeping, I would strongly suggest at least trying to, move from a position like this to more of an open one. So trying to open up the front of the hips as much as possible. Okay, so let's start with that. Please stay tuned in the coming weeks. I've got a lot more info for you about opening up this muscle, engaging different muscles to get you feeling better. Please visit my website if you'd like more information or to book an appointment, stephgeorgelmt.com. And follow me on Instagram and Facebook, and like and share this video. Thanks so much. Have a wonderful day.